Unwelcome but expected, the coronavirus has hit the UK.
The first confirmed case of coronavirus in the United Kingdom was found on January 31st, 2020. First off, the government's strategy was to try to contain the virus by setting up quarantine centers for people coming back from China, tracing the contacts of infected people, and advising its citizens to wash their hands. It was not until March 23rd that Prime Minister Boris Johnson announced a complete lockdown of the United Kingdom, banning people from leaving their homes or meeting in groups of more than 2 people, as the government was trying to enforce social distancing measures to prevent the spread of coronavirus. Just like many other countries, the summer went on and the United Kingdom did not escape from a second wave of the coronavirus pandemic. At the beginning of October, the United Kingdom was the most affected country by the pandemic in Europe. In mid-October, Ireland and Wales imposed a lockdown for respectively 6 and 2 weeks that were soon followed by England.
And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives.
Boris Johnson announced a second national lockdown across England, starting from November 5th until December 2nd. To face this new wave of cases, the country developed many measures. On November 6th, Liverpool, one of the most affected cities by the second wave, put in place a massive and rapid testing program.
It's important for the city that we bring this virus back under control. This is a way of doing that. It means that we can identify asymptomatic people who have the virus and don't know they've got it.
Testing was one thing, but every eyes were turned on the race for a vaccine. Quickly, the UK became the first country to authorize the use of the COVID-19 vaccine developed by the US laboratory Pfizer and its German partner BioNTech. December 8th marked the start of the vaccination campaign, making it the first country to launch a national vaccination program. A 90-year-old patient, Margaret Kinnan, was the first to receive the vaccine at Coventry Hospital in central England.
Go for it because it's free and it's the best thing that's ever happened at the moment, so please go for it. That's all I say, you know. If I can do it, well, so can you.
The country is now accelerating the vaccination process. It is reserved from the time being to some of their caregivers and residents of retirement homes. A generalization is planned for spring. According to BBC Counts, the UK has ordered 7 different types of vaccine in recent months, for a total of 355 million doses expected. But as Christmas was right around the corner, a shadow came upon and blurred the good news that seemed to be brought. A new strain of COVID-19 appeared, leading to lockdown for the 16 millions of people living in London and in the southeast of the country. In just a few days, 1,000 patients have been infected by it, according to British health authorities.
It seems that the spread is now being driven by the new variant of the virus, which we spoke about earlier this week and learned about earlier this week.
Named Variant Under Investigation, Year 2020, Month 12, Variant 1, this variation is apparently 50% more contagious, including for children, according to a study published by Public Health England. Fearing the unknown, multiple countries decided to suspend their flight to the UK. The Netherlands were first, followed by Belgium, Italy, Germany, Ireland, and France. This came after British Prime Minister Boris Johnson announced tougher measures to combat the new virus strain. Officials said while the new mutation is much more easily transmitted, it's not thought to be any more dangerous. Despite the measures put in place, there has been an increase of new cases after Christmas. Southern regions of the country warned the government about the saturation of health services, like the county of Essex, one of the most affected in England, where health workers called for the intervention of the army to install field hospitals. Up until this Monday, sharing the country in zones was the strategy chosen by the government to avoid a national lockdown, a strategy not everyone agreed on.
But for now, I'm afraid you must once again stay at home, protect the NHS, and save lives.
Many members of the government were pushing for this option, and in the end, Prime Minister Boris Johnson announced this Monday a total lockdown of the country until mid-February. This new one is as strict as the one put in place in the spring, with school closing down on Tuesday. A few hours before, Scotland had made a similar announcement with the closure of schools as well. Northern Ireland and Wales had already instituted their third lockdown just after Christmas.
We have a special guest today to illustrate the situation. Charlotte, a friend of mine who lived for 3 years in England. So hi Charlotte, please introduce yourself.
Hello. Hi. I'm Charlotte. I'm 20 and I've lived in England for 3 years, and I live in Lancaster, and I'm studying in Lancaster University.
And can you describe how the situation is like where you live?
Well, first of all, do you see where Manchester is? Basically, Lancaster is a bit above that. So it's kind of in the same area. It's Lancashire, the county. In England, there's like this thing where the country is divided in different tiers. There's like tier 1, tier 2, tier 3. Now there's tier 4, but at the time there were only 3. The third one being like the most strict one. That makes sense. So Lancaster was in tier 3. So we were in the hardest form of, I wouldn't say lockdown, but the hardest form of restrictions. So basically it was kind of a please don't go out of your place. But the masks weren't mandatory. You could travel. You were basically allowed to do anything. The restaurants were closed. You could only take away or deliver. Some shops were closed too. When there was this kind of extreme lockdown-ish, because it wasn't lockdown, but in December, at the same time as France, I believe. The shop closed then, but before they were still open and stuff. Like it was not a proper lockdown as it was in France.
And when you came back to France, how was it in the airports, or I don't know which transport you used, but how COVID changed your traveling habits?
Well, I usually take the plane back and forth, but then there was no plane back, basically. There was like one, 6 a.m, so I couldn't go. So I took the train for the first time in a while, because I live in the north, so it's kind of difficult to go back to London and then go back to France, but I did. And basically nothing changed apart from the fact that we have to wear masks, because they asked for a sort of declaration that we have to write, handwrite basically, and we had to say that we didn't have any symptoms or COVID or whatever. We didn't even have to take a test, but they didn't ask for that letter at the frontiers basically. So literally just handed our passports and that was it. So literally nothing happens apart from the fact that there was no plane back, in a way.
And do you miss your university life, or?
I do, but I think that, I haven't been in my university, in person, in maybe a year. So I'd say I miss it, but now I'm kind of used to it. The clubs are closed, the pubs are closed.
And didn't you feel lonely when you were still in Lancaster, working from home?
I'm lucky that I have a roommate with me.
Oh, nice.
So I wasn't all by myself, but I think that if I didn't have a roommate back there, I would just do my study from France, from home there, because it's not in person, so it's an online thing, so I didn't even need to go there. So I would probably just stay in France if I didn't have a roommate. So that was okay. That's fine.
And to finish, how would you say British people deal with the sanitary crisis in general?
I can only speak for people from my age group. But basically, it's not that they don't believe in it. It's just that they don't really realize, I think, because of the government not saying everything and the fact that the masks are mandatory, so they don't see why they have to wear a mask. They don't really understand the situation. I'd say that mostly it. They just don't really get it, and they don't think it's as bad as it is. And when I talk to them about the lockdowns in France and the proper lockdown, they're not amazed, but they're wow, why do you do that? Is it really necessary? Blah blah. So they just don't really realize it, I